My subject today is public-private partnership, or partnership, in fact, of any kind. So let me start by nailing my colours to the mast. We are living longer, and that is a cause for celebration. Aging is a good thing for us and for our societies. We are not a burden, despite what others may say, and it is up to us to prove the naysayers wrong. Naysaying is what they do best, and what we must do better than anyone else is make the compelling case for healthy and active aging. And that is easier said than done, I recognize that. But I define healthy aging very simply and very personally. Namely, that I enjoy significantly better health than my parents did at the same age. And I do. There are all sorts of reasons for this, not least of which is pharmacological intervention and innovation. Now, you'd expect me to say that, of course, but there are also other reasons: education, the environment, and many more chances and opportunities that the people of my parents' generation, born before the First World War, could ever have expected. When I was born in the early 1950s, globally, the percentage of people over the age of 60 was about 6%. By 2010, that number percent globally was 12%. And by mid-century, by 2050, that number will be about 22%. That is almost a four-fold increase in the people over the age of 60 in 100 years. The numbers in India are slightly different. Presently, the number of people over the age of 60 in India is about 7%. So that's what it was globally about 50 or 60 years ago. But by 2050, you expect to be at about 20%. So you will reflect the global numbers. A four-fold increase in 50 years. And that really shows that India not only is catching up, but is catching up and growing far faster than is seen in the rest of the world. So aging is highly relevant here as it is across the globe. So how do we make the case for the uplifting influence of healthy aging? How do we inspire and motivate all generations to live more healthy lives, acknowledging that it is not always possible to avoid disease and disability, loneliness and despair, which often are a major problem for older citizens? And how do we support those who commit themselves to looking after those in need of care? Well, obviously the answer for me is we do it together. No one can do this alone, which really makes the case for my discussion very clearly on public-private partnerships. I believe in partnerships of every kind imaginable: public-private, cross-sector partnerships, whatever you want to call them. They have been contributing to favorable social outcomes and impact for as long as probably any of us can remember. Partnerships have long been part of the fabric of philanthropy, of course, and have increasingly become part of the movement to achieve socially responsible and commercially sustainable outcomes. I have worked in the public sector. I worked in the public sector at the start of my career in the National Health Service in the UK, but most of my career, these past 40 years, has been in the private sector, in the pharmaceutical industry. And I have seen at first hand the many public-private partnerships that we can point to today that have lifted up the lives of people around the world. However, one of the obstructions to successful public-private partnership can often be waiting until everyone is in agreement about what to do, so-called consensus building. Before moving to act, waiting for everyone to be in agreement, you may wait forever. The pace of change in aging demographics, I believe, is too fast for this. And sometimes I even feel as if we're going backwards. For example, recently at the World Health Assembly in Geneva last month, discussions to overcome the bottleneck in World Health Organization engagement with non-state actors, including NGOs, academia, foundations, and the private sector were postponed until next May, after many years of discussion, debate, and what seemed like consensus. That is disheartening. Civil society, and by that I mean NGOs and the private sector, were recently disappointed by the terms of reference of a new global coordination mechanism meant to facilitate multi-sectoral and multi-stakeholder engagement around the rising challenge of non-communicable disease in low and middle-income countries. That is disheartening. And at the UN, a decision to establish a new forum to facilitate new public-private partnerships, new initiatives like Every Woman, Every Child, to help address the successors to the Millennium Development Goals, was postponed for 2 years because of concerns over conflict of interest, merely prolonging the inevitable while doing untold harm. It's clear that governments and multilateral institutions are in a leadership position when it comes to establishing broad multi-stakeholder platforms. They have a choice, well within their rights, to choose to include or ignore non-state actors in helping to achieve their development goals, including healthy aging. Most public sector people I speak with see a clear benefit in involving the private sector, as well as NGOs, academics, and foundations. We may all want to ask ourselves, am I helping or hindering the establishment of progress in the cross-sector public-private partnerships? My training as a physician really does not allow me to prevaricate and sit on my hands and wait for everyone to answer the question. In many cases, individuals committed to enabling partnerships get caught up in large bureaucratic organizations, both public and private. In fact, rather than wait for things to get worse, we must engage and demonstrate our impact. Let's get caught doing something. And let's all remember that the most important work gets done when no one is looking. Of course, before you enter into a public-private partnership or a partnership of any kind, there are several key factors which are necessary to ensure that it will be successful. Both parties have to have alignment of objectives, that is very clear. They have to have clear rules of engagement. They must have defined measurements of outcome and ultimate success, and they must have the opportunity to course correct during the project. They must have a clear communication plan and transparency and accountability. I often hear objections to public-private partnerships around conflict of interest. I believe we should focus on looking for alignment of interest, and I believe that that will give us far more success. But if we have the provisions I've just talked about in place, and with a proper enabling environment, we can achieve miracles. From a purely personal point of view, I have seen great work in the field. So let me just tell you about a few really effective examples that I've been involved in. Working with Help Age International and Help Age Tanzania, with the involvement of the Ministry of Health and volunteer older people organizations, we're showing that public-private partnerships can make a difference in the health and well-being of older people in some of the most remote and poor parts of the world. Some early indicators of our collaboration clearly demonstrate the favorable impact. For example, the number of older people and their caregivers with improved understanding of the causes, symptoms, prevention, and management of non-communicable diseases increased from roughly 27% to 81% in the course of a relatively short time. The number of older people who quit smoking and drinking alcohol excessively increased significantly during this period, on average reducing the number of smokers and those who drink from 75% to 35%. And the number of older people reporting improved attitudes of healthcare workers towards older people increased from 20% to an average of 93%, all during the course of a relatively short public-private partnership. Also in the workplace, the role of the employer, whether in public or private organizations, will be critical to how we address the challenges and opportunities of the aging demographic. Addressing the need for caregiver support, evolving the workforce model to allow for multiple generations, including contributions from older workers who want to keep working. And I am one of them. There are other striking examples of public-private partnerships in the workforce. Earlier this year, Nespresso announced a partnership with the Colombian government and Fair Trade International to establish retirement provisions for Colombian coffee farmers in the insurance and in the insurance industry. Swiss Re has pioneered public-private partnerships with relevant governments in parts of the world where hurricanes and earthquakes are a constant threat, including in Mexico and the Caribbean, to use insurance and capital market instruments in risk transfer and reduction. And all of us know that older citizens can be extremely vulnerable in such situations. They can also be incredible resources in times of crisis, which is why focusing on the role of the employer or government alone is clearly insufficient, given the vast percentage of people at all ages working in the grey and informal markets. This is where you will likely find the greatest number of older workers, though it will be difficult to find data for confirmation. This is currently one of the greatest gaps in our knowledge and efforts. This is where we need to harness the creativity of the private sector and the social mechanisms of the public sector. Demographic aging is affecting more than just the lives of the people who are older themselves, senior citizens. We need to focus even more attention on public-private partners to foster intergenerational understanding and engagement. Instead of simply calling for more attention on older populations, perhaps at the cost of programs aimed at helping mothers and children, for example, we need to find solutions that address the needs of all ages. It's not a question of choosing or favoring one over the other. I believe we can do all of this. A more balanced solution to meet the needs of each group can and should be found in intergeneral approaches. Getting back to the example that Pfizer has been working with Help Age in Tanzania, the evolution of the program to address the needs of older people will involve the engagement of younger generations, and in fact Save the Children has joined the mix. And the project will involve all generations in ensuring a healthy and active old age for all. This means, for example, including younger age groups in both health promotion and prevention programs, such as reproductive health. Working with midlife and adult age groups also includes geriatric care in health training and running intergenerational interaction programs, and bringing young people and older people together to improve health and quality of life in old age. I believe that healthy younger people have a much greater opportunity of becoming healthy older people. The Millennium Development Goals, the MDGs, which have been talked about at some length at this conference, are aimed at addressing the needs of the world's poorest and most vulnerable, especially relating to women and children, HIV and AIDS, malaria, education. But let's also not forget that MDG 8 is Create a Global Partnership for Development. We still have a long way to go in this, although to date quite a lot has been achieved too. The post-2015 development agenda must build on what has been achieved. That is clear. But for me, a logical extension would be to include our older citizens. And we are struggling to make this happen. Overnight, we heard that references had been removed in the current draft. Imagine the progress we could have made if MDGs had included a goal addressing the needs of older people, just as it did for mothers, newborns, and children under 5. For example, immunization is widely recognized as a life-saving procedure in children and young adults and has saved millions of lives since immunization was first invented. But there is still complacency about simple health steps like a flu vaccine among the general population. Older people also need to be up to date with their vaccinations, and this could be well addressed in the post-2015 agenda. We have a great opportunity. There is hope. I always believe that there is hope as the new goals and targets are being written. And advocates such as HelpAge, AARP International, IFA, and the NGO Committee on Aging, and others are working to ensure older people are recognized in the global priorities of the post-2015 era. And we must not give up. Healthy younger people become healthy older people. I think we should embrace that. And the post-2015 agenda would be so much richer by recognizing the full course and fixing targets for healthy aging. And if ever there were an opportunity for a public-private partnership to work and make a difference to global public health, then I believe this is it. I believe firmly in the possibility of public-private partnership. We live in an age where public-private partnerships have the power to change the world for the better. And as each of us ages, we have the opportunity to offer our own unique contribution. As we've discussed this morning, public-private partnerships can do immense good for people all over the world and in many different situations. In my own experience with HIV and AIDS, the assessment of vulnerable elders and in intergenerational solidarity in education and in so many other areas, I'm not just talking here about philanthropy, but I have seen so much success here. Healthy business can bring enormous benefit to a society and can reap great benefit too. But with this comes the moral responsibility to operate ethically and with integrity. And businesses can play an even greater role in society, including shaping policy and developing structures and systems that benefit everyone in the community. We must not be prejudiced against partnering with organizations which may traditionally be at opposite poles of the social spectrum. And this is not a competitive sport. There is too much work to be done. And while there is an irrefutable moral case for doing everything we can, let's be clear that no one has the moral high ground. I consider myself to be a corporate activist, and we are all fighting for the rights of the people we serve. And together we can do far more than the sum of our considerable parts. So let me close by reminding of us all that this, as Muhammad Yunus told us yesterday, is a great time to be alive. While we may not be able to stop the clock moving forward, there is so much that we can do about our own aging and about those of others. Super happy is by helping others. Everyone in this room clearly has a prescription for super happiness because of their engagement to making a difference to people's lives. Let's get the older agenda into post-2015. Let's look at ways of working together to make a difference, because ultimately that is what lifts up the lives of everyone that we come in touch with. Thank you so very much for giving me the opportunity to speak.